Today, I wanted to venture into the world of repetitive strain injuries, or RSI for short. With the COVID-19 pandemic and things like esports actually becoming a real sport in the era of different sporting events, we are seeing this type of injury more and more. Let's talk about some of them in more detail. In particular, today, we're going to go over carpal tunnel syndrome. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. Be sure to subscribe to my videos if you want to stay up to date on the latest content. For now, let's get back to talking about carpal tunnel syndrome. So carpal tunnel syndrome is something I see as a sports medicine doctor quite a lot. And not only will I see it in people who have desk jobs, I'm starting to now see it in children and in professional athletes who do esports, for example. So this talk is going to be very pertinent to those who are interested in esports, but those who are also doing a lot of desk work and work from home with the COVID-19 pandemic. All right, so what is carpal tunnel syndrome? Carpal tunnel syndrome is an entrapment of the median nerve at the level of the carpal tunnel. I said a ton of words. Let's look at a picture to get a better idea of what it is. This is a hand, and essentially I've cut it off at the area of the wrist so we can see a transverse cross-section of the wrist. This area you're seeing right here corresponds to this area on my wrist in person. And what you see is that there is this nice little connective tissue segment, which is called the flexor retinaculum. It holds everything down nice and happy. And what it does is it's a cover for something called the carpal tunnel. Now, if we go and look at the cross-section here, in this carpal tunnel, so these are your wrist bones here, you will see that there are a series of 9 flexor tendons. So these are all the tendons that do this type of motion in the hand, aka very important tendons. And what you see here is there's a poor little nerve that's hanging out here. And that's your median nerve. So you'll see that yellow nerve right here. And as you can see, it's quite a tight space, and there's not a lot of space within it. So this is where the entrapment occurs. And there's 2 mechanisms by which you can get carpal tunnel syndrome. One is compression. So you're thinking as keyboard typers, you're constantly putting your wrists down, you're tilting them up, and there's a good amount of tension right at that space. And as you saw how small that space is, repetitive tension in that area, or repetitive compression in that area, can cause a lot of inflammation, thickening of the actual nerve and the other tendons, causing the space to get smaller. When the space gets smaller, things get compressed. When nerves get compressed, you'll get symptoms. And then the last mechanism, or the second mechanism of carpal tunnel syndrome, is actually tension. Tension is one of those things, if you stretch a nerve too much, for example, if anyone's had a burner or zinger when they're stretching their head, that essentially just makes the nerve unhappy. Before we discuss the symptoms of carpal tunnel syndrome, it is important to know what the function of a nerve actually does. The nerve provides 2 main functions. Number 1, sensation, so your ability to feel things. Number 2, motor, so your ability to use your muscles. Naturally, that means that we would see symptoms impacting both motor and sensation. Now, one really interesting part when it comes to nerves is that they follow a pattern in terms of the areas that they provide motor and sensation function to. The median nerve, if we look at this picture here, provides sensation to the palm aspect of the hand and the first 3 digits, as well as half of the 4th. And you'll see that corresponding right here. It also provides sensation to the back fingertips of the first 3 digits. So what are the main symptoms of carpal tunnel syndrome? Pain, numbness, and tingling are your biggest ones, especially in the nerve distribution that I had spoke about just earlier. The other symptom that we'll notice is a lot of people will be losing their grip strength. So the median nerve provides a lot of mobility and strength to the thumb. So it actually provides the ability for the thumb to abduct or come outwards like this. And as you can believe, that's implicated in things like gripping. So people will come to me and tell me they can't grip things, they're dropping coffee mugs, or that they have a lot of night symptoms. And typically when you fall asleep like this. We don't know it, we can't control it. When you fall asleep like this, you provide a lot of compression to the nerve, and that's why many people will wake up with night symptoms. One late finding of carpal tunnel syndrome when the nerve is so damaged is that this thumb muscle here will start to become wasted and weak. So it won't look like a nice little drumstick from Kentucky Fried Chicken, but a pretty sad, weak little wasted muscle. So how do we diagnose carpal tunnel syndrome? Believe it or not, I can make this diagnosis pretty much based on the history and my physical exam. So we talked about the symptoms. What do I see on exam, and how do I test it? I'll test for any sensation changes kind of in the first 3 digits. So normally people will say that they have increased pain or that there's decreased sensation in the first 3 digits. The next thing I'll do is I'll test their thumb function because that's a part of the median nerve. And usually I'll get them to hold their hand like this and I'll try to push it down. Or I'll try to get them to do this and make an okay sign. If the median nerve is impacted or you have symptoms of carpal tunnel syndrome, it'll either be extremely painful or weak to do that. Another test that I'll perform is called the Tinel sign. It's where I actually tap the carpal tunnel area quite vigorously, and it should reproduce the symptoms in those who have carpal tunnel syndrome. The last one is actually the Phalen's test. So that's a reverse prayer, I say. And if you can imagine, it actually compresses the carpal tunnel. I get someone to hold this position for 30 seconds, and if it recreates pain or numbness and tingling in those 3 fingers, that's a positive test. And what do we do if we suspect carpal tunnel syndrome in people? Number 1, I send them for nerve conduction studies because we actually want to see how badly the nerve is damaged. And depending on how bad the nerve is damaged, we can decide whether or not we need to trial conservative treatment or if surgery will be indicated. So if you've been told you have mild carpal tunnel syndrome, we trial conservative treatments first. What does that mean? So anything that's not surgery. So medications like Tylenol and Advil to help with inflammation and pain. We're really big on actually wrist splints, particularly at night, because we know we can keep the nerve nice and straight when you go to sleep and not compress it. So there's actually a lot of evidence for that helping the inflammation and the decreased space in that area. The next thing we really recommend is activity modification. I know many people don't like to hear it, but you have to get up from the computer. You need to get a better keyboard. You need to get an ergonomic mouse such as this, for example, so you're not rotating over that much. And I learned the hard way, for example. But things like that are extremely important. Figure out what is causing you symptoms and change your activity or change your pattern so that you can avoid repetitive overuse injuries. Another conservative treatment that we will trial a lot is steroid injection. So we can do that under ultrasound guidance. I'll go into the median nerve, and actually there's a covering to it. And in a lot of cases of carpal tunnel syndrome, we see that median nerve or that covering quite large, and there's a lot of swelling within the nerve. We can put that steroid injection in there to help calm that down and relieve your symptoms. And the last thing we recommend is physical therapy. There have been some studies on median nerve glides, so really positioning yourself and doing glides of your median nerve so that you can help mobilize it within the tissues. You can look that up. Some people do find a benefit with it. And then the last type of treatment that we're talking about is surgery. And surgery is actually a pretty quick procedure. It's a day procedure. Most general surgeons, orthopedic surgeons, plastic surgeons will do it. And essentially what they do is they cut that flexor retinaculum. If you cut that and take away the cover of the actual tunnel, there's less pressure. You essentially need to take 4 weeks off of doing anything too strenuous with that hand to avoid scar tissue to build up. But after then, there's approximately a 95% success rate. So people are quite happy with it. And usually they don't tend to recur if you follow your post-operative instructions. Now, with all this being said, COVID has resulted in many of us having to stay at home, work from home. So we are going to start seeing some of these injuries more and more and more. So it is important to be aware of them. If you think you have them, definitely try to change up your routine. And if you're really worried about pretty severe symptoms, definitely get checked out by your doctor and get more information. If you like this video, please click on the like button. If you want to stay up to date on videos I do in the future where I break down injuries so that an average fan can better understand them, please subscribe to my channel. For now, that's all.